Are you ready for on the ledge VIP? Let's get to it. Welcome to episode 12 of On the Ledge VIP. This is your host, Carl Calder. Thank you for joining us today. We're going to have a great show. My guest today is Miss Cindy Horton. She is a fantastic person, a good friend of mine, and she's going to break down open enrollment. So the name of the show is called Open Enrollment 101, talking about healthcare. She is very knowledgeable, very experienced, and I can't wait for her to share all the information, the nuggets about how to do a proper open enrollment and all the do's, the don'ts, and just some stuff that y'all may not know about. And she has so many tips, so many. So here you go, Miss Cindy Horton.
My name is Cindy Horton. My company is KIS, Keeping Insurance Simple, LLC. And today we're going to be talking about Open Enrollment 2020 for the health insurance marketplace as well as alternative.
Does marketplace mean the same thing as Obamacare?
It is. It is Obamacare. Is the health exchange, which is the Obamacare, the Affordable Care Act, marketplace, healthinsurance.gov. So it's all of those, but most people know it by Obamacare.
Okay, cool. So when does that officially start?
It starts November 1st through December 15th. It's only a 6-week window in which we need to get consumers enrolled. After that, the only time you can get enrolled is if you have a SEP, a special enrollment period.
Okay, all right. So what happens in that special enrollment period? How long, if they miss the 15th of December, they got the special enrollment period, how long does that last?
That lasts for 60 days. So for an example, if someone misses the open enrollment period, which ends December 15th, then say for an example, if they had insurance through their employer no longer offers insurance, then they have 60 days to get that insurance through the marketplace. That's what's considered an SEP, or a special enrollment period. Or if they were with an employer and they switched employers who did not have insurance, again, they have that 60-day window. They only give them 60 days to get insurance again.
Okay. Is there any penalty within those 60 days? Do they get penalized?
No, there is no penalty. The only penalty that used to exist is for consumers who did not get insurance during open enrollment. They were penalized for not having insurance, but that mandate was taken away.
Okay.
So that no longer exists. You don't have to have health insurance, but it's wise to have it.
Okay. So after 60 days, let's say they still did not enroll, what happens then?
In that case, they cannot enroll in a marketplace plan or a Obamacare plan. They do have an option to get an alternative plan, which you can enroll in 365 days of the year. However, you can be denied because of pre-existing conditions.
Okay, all right, well, cool. So let's talk about enrollment. What is the first thing that we need to be looking out for this year?
Well, the first thing is that time period is so crucial because so many consumers are it's not being advertised, first of all.
Oh, you're right. I have not really seen. I see a little bit now with the Medicare.
You're going to see commercial after commercial after commercial about Medicare, which is over 65. That enrollment period is from October 15 through December 7. It sort of runs concurrent with the under 65 age for the Obamacare. However, it's highly advertised. You don't hear advertisement for the Obamacare, which is unfortunate because a lot of consumers don't have a clue that it's even still around, that it still exists, and that they can still get help with paying for it.
Okay.
So the main thing is that we get the word out that it still exists and that you have to do it within this time window.
Right. So most of the time when they do open enrollment, I know you talked about it not being advertised. I know as far as if you're working for a company, the company definitely pushes that information out. But as far as the public, You're right. I haven't seen anything.
No, not at all. Not at all. And most employer plans, they have their own special enrollment period, and it can be any time of the year. It just depends on the company. Now, what I have found out, Carl, is that a lot of employers are insuring only full-time employees. So that leaves sort of a gap for their part-time employees with no insurance. So they're happy to see me come along because now I can assist those part-time employees, meaning under, say, 30 hours, with getting some affordable health insurance, which they didn't have before. So sometimes employers want to keep them under a certain number so that they would go to the marketplace. Well, the problem with the marketplace is that it can be a bit confusing. So that's what I'm here for. I'm here to make it simple, KIS, keeping insurance simple. And I pretty much hold them by the hand, okay, so that they can not be so fearful or think that they're making a mistake or they put in wrong information and they're getting wrong information out. Because a lot of times they will go into the marketplace, put in the wrong numbers, and it comes back denied or this huge astronomical premium. And a lot of times it's just human error. They just don't know or it's very confusing for them.
Okay. So someone that comes to you looking for some insurance through the marketplace, how would you be able to help them out? What's the steps?
Well, first of all, I'm going to, see what it is that they need because everybody, the marketplace plans it's not a cookie cutter. Everybody's not going to fit into that box for marketplace. First of all, you have to you have to have some type of income. It's not that you have to be working. If you are working, it can be from an employer. It can be from self-employment. It can be from unemployment. Unemployment is still income.
Okay.
It can be from disability insurance. It could be from a pension, and you're not 65 yet. It can still be from a pension. So, first of all, we want to make sure they qualify. So once I make sure that they're qualified for it, then we go ahead and start the enrollment process. Because basically, during open enrollment, it's the gates are open. Right. Everybody can apply.
Right.
You just have to be working. There are some situations when it comes to marital status. I might have some people who are married. All income is included in that household.
Okay.
So you have to ensure that all income is being reported and that taxes, when you are married, are filed jointly.
Okay. Now, when you say that, let's say a mother that's receiving child support, does she have to report that?
No, she does not. She does not have to report that situation. There is, and it varies. I mean, it could be a whole lot of different scenarios that take place. So the main thing is that once we establish they have income, then we go into other aspects of their particular status or especially marital status, because that marital status is huge because some couples do not file their taxes jointly with good reason.
Right.
So if that is the case, then that couple really got to look at, because we're going by not the current year, but the year we're talking about enrollment for. So right now we're talking about enrollment for 2020, not 2019. So what the federal government, because they're giving this tax credit, is looking for is income for 2020.
Oh.
We don't know what that income is because we're not there yet. We have no idea.
Right.
Okay, but it's sort of a guesstimate. But with marital couples, what the thing that consumers have to understand is that if you don't file jointly, you do not qualify.
Are you serious?
I'm dead serious. You don't, because they're looking at it's directly tied to your tax return. So if you're filing separate and you're getting a tax credit based on, and matter of fact, that's one of the questions on the applications. Do you and your spouse file joint taxes? And if it's no, then it will not go through. You have to file joint, because you're going to get at the end of 2020, you're going to get your 1095A form, which is going to have how much tax credit you got based on you saying you were married and filing joint. Well, if you file your taxes for that year separate, you're going to end up paying that money that you got from the premium tax credit back to the federal government.
That's why individuals or families need to go to a pro.
Exactly.
Because you are a pro. Because I'm learning things right now. So I was like, I didn't know that either. Okay. So let's say once they enroll, what happens after that?
Excuse me. So once they enroll, we get through all of the processes and they qualify and they can enroll. I go ahead and complete the application. They're given an application ID number. And the application through the marketplace is the application. It's separate. The marketplace is the federal government. That's who's giving you the tax credit. Okay. Now, once you get enrolled, we're going to select a carrier for you for your insurance. Okay. That's separate. Okay. So the federal government, the application itself is with the healthcare.gov. Okay. That's who's giving you the finances, the money to help you. They're giving that money or their portion to the insurance company. That's separate. That if you have any issues with your say deductible, you don't want to call the marketplace because they don't have nothing to do with your deductible. Okay. If you have a problem, if you have a situation where you need to change your address, you want to contact the marketplace, not the insurance company, because the healthcare.gov sends your file over to your insurance company.
All right.
So it's different. And again, these are things that I educate my consumers on as far as your application is with healthcare.gov, your insurance is with your insurance company.
Right. So you're making it much easier for an individual to come to you instead of actually going to the website, because I've been on there before.
Yes.
It's very complicated.
Yes,
it's very frustrating.
It
might take me about 3-4 days, maybe even a week to complete it because
it's so confusing. Yeah. And it's designed, I hate to say it, but it's so confusing for consumers. And the bad part of that is that I've had consumers call me on December 16th and said, I just couldn't figure it out. I just got stuck and it told me I had to pay $400 when I only make $16,000. So something went wrong.
Right.
However, those consumers need to call me prior to December 15th so that we can get them in.
We want to make sure they call you at least by December 1st.
Right. Exactly. And that's exactly what ends up happening. That's what ends up happening. I know last year, 2019, the cutoff, I'm in Georgia, so the cutoff is midnight, but they go Pacific time.
Okay.
So that gives us an extra 3 hours. I had a young lady call me an hour before Pacific time ended. And she was struggling, trying to get herself in. And I've had her before, but she just ended up calling me, Miss Sandy, I'm like, okay, come on, honey. Let's get you done. And we got her done.
Okay, cool. So what are the major players, these companies, insurance companies that are participating this year for the open enrollment?
For 2020, we have some new players. So we still have Ambetter from Peach State. We have Kaiser and Blue Cross Blue Shield. We're going to also add on Oscar, and we're going to add on CareSource. And CareSource, and it's a good thing for consumers because, of course, when you have all of these new players, what's going to happen is competition. They want the consumers to pick them. So, which is good for the consumer. They're offering some great things that I've never heard of before. So this is my 6th year doing this, and it's like, oh, wow, they're offering this now?
Okay. So can we compare these new players that just got in? Mm-hmm. Can we compare them to like the cell phone industry?
Sure, absolutely. So
everybody got their pros and their cons.
Yep, absolutely. So take Oscar for an example. Oscar is highly cell phone app user friendly. So for those millennials and those non-millennials who like to use their phone for things, they can actually load the app on their phone if they're enrolled. And actually contact one of their care team members. That care team member will make their appointment for them, schedule follow-ups, find a hospital in the network, take their payment, all kinds of things right there on their phone.
Yeah, That sounds like they're targeting millennials.
Yes. Yes.
I even like it, and I'm not a millennial.
I know, right? Well, let me tell you a quick story, Carl. I'm not a millennial either. However, I'm with Ambetter right now, and they sent me a card at the Teladoc, and most plans now have Teladoc, which is a wonderful thing because a Teladoc will save you so much time and it's wonderful. I used Teladoc this past weekend. I had this card in my wallet for like a year, and I was coming down with the sinus infection, which I get like clockwork. And I had a big, huge event Saturday night, and I was like, okay, what am I going to do? I can't go to. I'm feeling really bad. So I pulled the card out, and I registered on my phone. I loaded the app, the Teladoc app, on my phone. Registered, answered a few quick questions about what was going on. A doctor called me in less than 10 minutes.
That's fast.
I had a prescription in my hand in less than 30 minutes.
Did they call it in for you, or
they did?
They did call it in. For
I told them who my pharmacist was, and they called it in. And that was Teladoc. And this is all done on your phone. So if you're not feeling well on the weekend or during the week and don't want to go sit in a doctor's office for 2 and 3 hours, the service is available on all of the marketplace plans. Ambetter, Kaiser, Blue Cross Blue Shield, Oscar, and CareSource all have Teladoc on there.
Okay. So what's the next one? The other new player. How do they fit in?
So CareSource is really coming in strong. They are a lot like Ambetter, but they're more care management as a care model. They service the whole person. They will help you find a job if you're looking. Yes.
They help you find a job.
Yes, they will help you find a job because you need to pay that premium.
Right.
And, all of these plans will, of course, you'll get assistance with the premium tax credit, but sometimes people fall on hard times. They need some help. They need some type of assistance besides, I got to pay my health insurance.
Right.
Well, how are you going to pay it if if you're struggling?
Mm-hmm.
You got to pay Peter, not pay Peter to pay Paul.
Right.
They need help. CareSource will do that. They are also offering a plan whereas if you get your dental insurance for them and vision, which is $20 extra, they will give you a free gym membership at most gyms.
Okay, because I was about to say, which gym are we talking about?
I go to LA Fitness, and LA Fitness is one of the
LA
providers.
Fitness is one of the providers. Okay.
Yeah, and so that's unheard of. You've never heard of that.
Yeah.
Ambetter in the past have had a fitness program, My Health Pays Rewards, where they loaded dollars onto a Visa card for you. And they're still doing that program, but it's changed a little bit, but it's still around. But this, is unheard of. They're giving you access to a bank account at Fifth Third Bank with no overdraft fees. So these things are unheard of that's coming into 2020.
Okay. I like both of those. So is Ambetter adding anything, or are they still the same?
Ambetter is adding more plans. They're adding more plans, which are very competitive. They've always been the most competitive here in Georgia. Mm-hmm. For the most part, a lot of people like Ambetter. They've come a long way. So they're adding more plans to give people more flexibility.
Okay.
As well as they still have their My Health Pays program, which is awesome.
Okay. So what are your hours of operation?
24/7. I know I'm not going to say that. My hours, I typically will start, because I am a night owl, I'll typically start around 9 o'clock in the morning. And during open enrollment, I kid you not, I do sometimes go to 11 o'clock at night.
Okay.
So it's a long day for me,
okay.
Especially the closer we get. I have consumers calling me all the time. And with urgency, because we have to get them in. Okay, Carl, you know what? I'm going to change that because people will be calling me at 11 o'clock at night. My hours are from 9 to 7 p.m.
Thank you for helping yourself out there.
Right, exactly.
Because everybody be calling you at 10 o'clock.
Right, exactly. Right. It's going to happen, but technically, if it happens, it happens, and I'm here to serve. But if it, with respect to my time, I would like to say 7.
Okay, cool. So let's talk about your website and how they can reach you if they need to.
Okay, sure. My phone number is 678-382-9923. Again, 678-382-9923. My website is, what is my website? Affordable Health Insurance, GA for Georgia. So it's affordablehealthinsurancega.com. You can reach me via email as well at gothealthandlife@gmail. That's GOTHEALTHANDLIFE @gmail.
You broke that down, so there shouldn't be any mistake, any problems with them getting in touch with you on there.
Right.
If they go into your website.
Absolutely, and if there is a page on my website in which they can also contact me. It's a contact page. So if you go to my website and you want to have me contact you that way, you can do that as well.
Okay, great. Now, since we talked about Marketplace, let's go to the alternative plans that are available for everybody. So give us a little insight on that.
Okay, perfect. So there are some consumers who will not fit into that box of Marketplace plans. They can if they want to pay more than their mortgage for their health insurance, because sometimes they don't qualify for the help with the premium tax credit. So there are some situations where consumers are paying way too much for their health insurance. So fortunately, some plans have come into place where they can still have, especially hospitalization plans, and not pay out the yin-yang to have health insurance. It's a plan with Philadelphia American, whereas we can give them or offer them an option of several different levels, and they can have their hospitalization covered. It's based on level that they pick, and it will cover them for that. Most people who do the alternative plans do it based on needing health insurance for if something major were to happen to them. They are not so much concerned with a copay or how much a copay for a doctor visit is or how much a copay for a specialist is. That's not their concern. Most small business owners want to be able to have the what is the word I'm looking for? They want to have the assurance that if something major were to happen to them, they would be covered. Okay, so that's where these plans come in. Unfortunately, these plans do not cover the essential health benefits that the Marketplace does. They do not cover, baby care, right, and all this other stuff. And the Marketplace is all inclusive. The alternative plans, you pretty much are picking and choosing what you want it to look like. But on the other side of that coin, you're saving a lot of money. You're saving a whole lot of money because those plans, $1,200 from the Marketplace, with an alternative plan, you may pay $300 or $400. So that's huge. You're getting your hospitalization. You're not too much concerned about paying out of pocket for a doctor visit. So the main thing is that if something happened to me, I'll have deductible. I'm covered. That's the main thing.
Now, from your experience, what age range or what type of professions would actually this type of plan would benefit? Because I know if you have a family, most of the time you want to go ahead and do a Marketplace for that. But let's say if someone is single and young, let's say a millennial business owner, would this be something that they might jump on?
No, not necessarily. I had a young lady just yesterday who listened to how much it would cost her through the Marketplace and decided to go with an alternative plan because she's healthy. All these alternative plans are underwritten, meaning that they will disqualify you for any type of pre-existing condition. So if you have a pre-existing condition, you will not get covered through that alternative plan for 12 months. Okay, anything else that's not going on is covered, but that pre-existing condition through the alternative plan will not be covered for 12 months. So it's just a matter of cost. Can I afford to pay $300 to the Marketplace versus $120 for an alternative plan? Right. Especially if they're healthy. She was healthy, so she decided to go with an alternative plan.
Okay,
You know, so it's not necessarily any type of profession. It's just, you know, personal situation.
Right. What fits them the best.
Absolutely. 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 And a lot of times the millennials, you know, they say they don't go to the doctor a lot.
They tell me that all the time. They talk about that with life insurance. And I'm trying to work with them on life insurance.
Right, exactly.
We talk
you know, and the main thing, though, is that, okay, so you don't go to the doctor a lot. That's fine. That's a good thing. But, you know, we don't wake up in the morning saying, oh, you know what? I'm going to go and have a car accident today. We don't know. Life is life. We just don't know what life holds for us when we walk out the door or even when we're in our homes.
Right.
You know, you could have a stroke and be 30 years old in your home.
I hear about a lot of people that are healthy, a bill of health, and something happens.
Absolutely.
They've done everything right. They
Absolutely.
Eat right, do everything they're supposed to do, but still, life happens.
Life happens. Life happens.
And you know what a great website? I don't know if it's lifehappens.org.
It is. Okay. It is Life Happens. And I'm a part of that organization. Mm-hmm. Yeah, lifehappens.org. Absolutely. Yeah. That's a great organization.
I would direct people to that sometimes, just to look at those videos because it hits home.
It does, and they are real life events that people face every day. Mm-hmm. So, in addition to Philadelphia American, we have Manhattan Life. The beauty of Manhattan Life, it works a lot like Philadelphia American. I sort of want to go back to these two plans, Philadelphia American and Manhattan Life, because these alternative plans are designed for you to file the claim. Okay, so with the typical traditional health insurance plan, Ann Better, Kaiser, Blue Cross Blue Shield, you're giving them your card, they're filing the claim, they're done. With these alternative plans, you want to file the claim because they're sending, if you get a claim in the mail, you are going to submit that claim over to the insurance company, whether it be a Philadelphia American or Manhattan, and they're going to pay you directly. So that money is coming into you, and that way most of the money stays in your pocket as opposed to the hospital or the doctor.
I like that.
Yeah.
Y'all have to forgive me here. Cindy, her hospitality is so fabulous. I'm munching on some pie here, apple pie, while we're doing this. And you can do that. No one can see us, but we're having a good time.
Yes.
Thank you, Cindy.
Is it good, Carl?
It's good. This is one of the key points of being a mobile podcast. I come and people just help me out. They just say, "Hey, you want something to eat? Yeah, go ahead. I'm just going to let you talk and do the whole podcast."
Right. His face is looking like, "Oh, this is delicious."
It is. So is there anything else as far as with these alternative plans that you want to share?
Well, the main thing is that if you file the claims yourself, you're keeping most of those dollars in your pocket as opposed to the hospital and the doctor. That's the beauty of those plans, is that you are able to keep most, because basically if a hospital or doctor, you can give them your card if you want to and let them file it, but I guarantee you they're not going to be sending you a refund check.
Oh, no, they're not.
You know, they're not going to be sending you a refund check, guaranteed. So the aim and the goal of these plans is designed for you to file your own claim. And if you were to, say, go into the hospital, you get a first day admission between $1,500 to $3,000. And every day after that you're in a hospital, you also get a benefit between $1,000, I think like $4,500. And that's based on your situation of being either sick or if it's an injury. Okay. The amounts are ridiculously high because they know how much these hospitals will bill you for. They'll charge you $50 for a Dixie cup.
Right.
So the average stay for a hospital stay in Georgia is $1,500. But on these plans, you can get upwards to $4,500. So with that being said, the rest of the money is in your pocket.
Right. I like that.
You know, and a lot of people don't know about this.
What about copay?
Copay, okay, so if you're talking about doctor visits, they will give you a benefit for your primary care. For Philadelphia America, you get 20 visits, okay? And it depends on which level you pick. So call me and I'll go more into information with you. If you go with Philadelphia America, instead of 20, you only get up to four visits for your doctor visits. It's a lot like Philadelphia American as far as the hospitalization. But these plans are designed, it's designed to cover you. Again, I go back to it covering people who don't care about a copay. They're not concerned too much about a doctor's visits or a specialist visit. They want to make sure if something falls on my head and I'm working out here and I'm self-employed, I'm covered. And I got to go to the hospital. They want to make sure the hospitalization is covered. So that is the meat and potatoes of these plans. The Manhattan Life, I just want to mention, does not have a deductible, but they do, and they also have a cancer benefit. So if you have a plan, you get cancer, they will cover you up to 40 days, and this is additional money on top of anything else. So that's unheard of.
I'm back, y'all. Cindy, talk about the accident one.
The accident, okay, so I also sell Aflac, and the accident is awesome because, it's interesting because the week after I got my accident plan with Aflac, I fell in my kitchen, and I thought I broke my arm. It was just sprained, but it felt like it was broken. So it paid for my visit to the emergency room. It paid for 6 visits to physical therapy. It paid for any follow-up visits. I ended up with a check for like $700. That is like, right.
See, I'm looking stunned over here.
Right, exactly. So the thing though is that an accident is so critical to have a accident plan because just like the commercial says, quack, quack, you don't know what's going to happen.
Right.
When you walk out your door or in the house. I fell right here in my kitchen on some ice, and I had an accident plan, and they pay day one. They pay day one, and they pay for 365 days of the year. So that's huge. That's huge. So I really, really cannot stress enough, especially you truck drivers, you're out there on the road, you have no accident insurance. I have a couple, they were a team, and they traveled together. And I constantly stayed on them about getting an accident plan. They did not. And they finally called me and said, Cindy, Barbara fell out the truck.
She fell out the truck?
Fell out the truck. Just took a wrong step. It was a freak accident.
Right.
Had no accident insurance. And it's just been an uphill battle. It's money. The accident insurance is designed to pay your bills.
Right.
Because you still got to pay your bills.
A lot of people don't understand when we talk about the health insurance, the life insurance, the accidental insurance, short-term disability, long-term. These are considered investments.
It is.
And you're investing into yourself.
Yourself. Making sure you're covered. Because if something were to happen, you ain't got to say, oh my God, how am I going to pay this bill? How am I going to pay that bill? You have money coming in.
Yeah.
To pay those.
Okay.
So you have to be proactive in making sure that your affairs are in order. You have to be, okay? Because after something happens, guess what? Ain't nobody trying to cover you or an event after something has happened.
Because right now you're considered a liability.
Absolutely. After you have an accident in your car, you cannot call up Aflac and say, I want an accident policy for something that's already happened. It's going to pertain to anything in the future, not current.
Right. I'm going to be wrong when I say this. They really look at you as damaged goods.
Absolutely. And that's the bottom line. Yeah. That's the bottom line. Damaged goods.
So,
yeah, and that goes across the board. When it comes to insurance. So I really, really want to stress being proactive in making sure your affairs are taken care of as far as your insurance goes, your health insurance, your life insurance. Make sure that you are covered and your family members are covered.
Got it.
Go Help Me is not an insurance policy.
Right.
GoFundMe is not an insurance policy.
Yeah. having a fish fry at the church
is not an insurance policy. And I don't even know if they do those anymore, Carl, because GoFundMe has just taken over,
right.
you know. But it is not. It is not. You know, when you can, you know, okay, so don't go get your nails done. Okay?
Right.
But get you some. My mom, that's one thing, God bless her. She always instilled that. And that's how I got into the insurance business, is because she instilled in us that if you don't have nothing in life, have you some life insurance.
Oh, yeah.
You know,
definitely.
And when it, you know, when I got laid off back in 2010, and I, you know, got into insurance, I was like, okay, I know the value of it, you know. So it's just knowing the value of protecting yourself and your family members.
Okay, you gave a lot of information, valuable information. I appreciate you. Is there anything else that we may have missed? Can you think of anything?
The only thing, Carl, that I do want to share, and this is huge, is because I have so many consumers who call me when something is going on with their teeth. And their teeth is something, they're in pain. They need to have a root canal. They need to have something done, and they're in pain. Well, up until now, there's been nothing, okay? Because if you have not had a dental plan in the past 12 consecutive months, whether through your employer or through a private plan, if it's something major, you have to wait 12 months. Well, now there's a plan that you can enroll in with Beam Dental. Call me, I'll give you more information on it, that has no waiting period. You can get your teeth clean. If you, right now is what, October 18th?
Yep, today's 18th.
October 18th. If you sign up today, you can be insured November 1st.
Okay.
And get a root canal.
I was just about to throw something out there like a root canal. Okay.
You can get a root canal. You're given 2 preventative, so you can get your teeth cleaned twice a year, your exams and your x-rays. Then you cover basic at 80%, which means extractions, and then they cover major at 50%. Okay, you do have a $50 deductible, but that's unheard of.
Right.
That's unheard of. I've been doing this for 6 years now, and this is the first plan. Not only that, but they will give you a vision plan also for no extra cost. So you get your eyes exam, go get you some frames or some contacts for no extra cost by joining this plan. For a single person, it runs around $36.
About $36.
$36, yeah.
Okay.
So that is huge. I have so many people who I have to say, you know, you got to wait 12 months. And this is, they will also send you, I sound like one of those infomercials where they go, and for, also we'll give you, no, this is for real.
Okay.
They'll send you an electronic toothbrush.
Okay.
Toothpaste and floss, and send you a replacement head every 6 months automatically.
I'm about to get that.
You should. I got it.
I've been looking at one of those toothbrushes that's go ahead and vibrate.
Absolutely. I got it. I canceled who I had, and I got Beam Dental. Seriously, it's just a no-brainer. It's a no-brainer. You get vision and dental. You get dental and vision. And you get the supply sent out to you, to your house. You pick the color toothbrush you want, they'll send it out. So that's huge. That to me.
I call that pampering. They just pampered me.
Yeah, absolutely. And it's very affordable. Very affordable.
Okay.
Yeah.
So let's do this. I'm going to give you another chance. Because I don't know. I keep saying, do you have anything else? And you just keep hitting us with some more.
No, that's it.
Is that it?
No, that's it, Carl. That's it. That's it. That's
All
it.
right. So before we end the show today, and I want to thank you so much for sharing this information. Once again, give everybody your name and all your information.
Sure.
So there's no way that they cannot reach you.
Okay, my name is Cindy Horton. My company is KIS, Keeping Insurance Simple, LLC. You can reach me at 678-382-9923. Again, 678-382-9923. My email is gothealthandlife@gmail.com. That's GOTHEALTHANDLIFE gmail.com, and my website is affordablehealthinsurancega.com.
Thank you so very much, Cindy. We appreciate you.
Thank you,
You
Carl.
have put down a lot of value on the show today.
Thank you so much. It was a pleasure.
Oh, yes.
And I'm glad you enjoyed the pie.
Thank you. I have to tell you guys something. I haven't had pie like that in some years. That was a very, very, very good apple pie. Thank you, Cindy. Remember, you can always follow the show on iHeartRadio, Spreaker, Google Podcasts, YouTube, and Castbox. And don't forget, all playbacks are on the website. That's ontheledge.vip. That's ontheledge.vip. Just click podcasts and you'll see the option there for playbacks. Also, we're doing a lot of advertising on the website. So if you love to advertise on my website, definitely come on, check out the pricing. We're doing a lot of things with commercials. If you want to do audio commercials, we're definitely doing that. If you want to do a podcast and we can't do it mobile, we can also do a conference call podcast. Please check out the advertisement page and also look at the packages. You'll find something good on there. Okay? Make sure you do that. I appreciate you. Until next time, you've been On the Ledge with Carl Calendar, On the Ledge VIP. Thank you. OMG, hold on for a second before I let you go. I got a quote for everybody. Check this out. If you don't find a way to make money while you sleep, you will work until you die. That's by your boy, Mr. Warren Buffett. Let that sink in. Until next time, I'm out.